in there, no, no, you don't want to live in that place. You don't.
B. Gutierrez says her home becomes almost unbearable every summer.
The sun starts on the south side and I'm on the very end unit, so of course it comes right in and stays all day long. Like the heat is just horrible, and I don't stay in the house much in the summertime.
The Calgary senior recently joined a rally calling for a bylaw that would require rental units to maintain safe indoor temperatures.
We need to pay more attention to the seniors because some of us are really growing and we're in places we should not be in.
As temperatures climb, many older adults are facing a hidden danger, extreme heat inside their own homes.
The places that we live in have, like I said, no insulation in windows.
Dr. David Hogan explains which medications and health conditions increase heat risk.
For example, you might decrease the use of blood pressure medications if you're at risk for getting dehydrated during hot weather. But don't do that on your own. Talk it over with a health professional.
Dr. Hogan sorts out fact from fiction and reveals the truth about heat and aging.
I've often heard this saying that by the time you feel thirsty, you're already dehydrated. Is there any truth to that?
I guess that depends a bit on your age.
What's it like to try to sleep in that?
I have a fan over my head. I got 2 fans going on the side.
Today on Unison TV, whether it's checking on a neighbor or encouraging a loved one to drink water, small actions can make a life-saving difference.
Older people are more sensitive to heat stress. As we get older, our sense of thirst, when we become dehydrated or dry, drops off. We don't concentrate our urine as well as when we were younger, and we don't sweat as well. We're less sensitive to increases in our body temperature as compared to when we were younger. So those are kind of physiological or normal changes. But also, in addition, older people are more likely to have conditions which might increase their risk or be taking medications that also might be a problem. And there could also be issues with mobility, frailty, less access to fluids, less ability to maybe leave a warm area and get to a cooler area.
Do we know why that is, that we don't feel as thirsty?
It's not clear. I mean, it's something that starts to happen with us. In our middle years, we sort of lose that ability to a small degree, every decade after maturation. And it just becomes, more evident, more obvious when we get older. Most of these changes have been found in experimental settings where people have volunteered for a study and were subjected to something like increased heat and, evaluated about how they respond. The kind of association with factors like living alone or having certain health conditions or taking a certain medication are driven more by studies that looked at what happens in heat waves and what type of problems arise and what are some of the risk factors for those problems.
Do we know if we feel less thirsty because our bodies need less hydration?
No, we need hydration. We just
So we don't,
feel as thirsty.
the need for it doesn't decrease
No,
as we get
absolutely not.
older.
No,
We
that's
just
right.
feel it less.
Yes. And so you have to kind of be aware of that and plan. Like, for example, like this morning I went out for a walk. Nice day, but a bit warm. So when I got back, I made sure I was drinking water. Have a cup of water by myself, by my computer, and I'm sipping away as we talk. And I don't feel particularly thirsty, but I know I don't have the same drive of thirst. And it would be a good idea for me to keep up and maybe prevent problems from arising.
Can you let us know some of the medications that we might be on that would make us more vulnerable to heat?
Yeah, there's quite a few medications, and might help to think of some of the reasons why and then talk about specific medications. It might affect our sense of temperature within our body. Some medications might lead to dehydration or low volume in our bloodstream. Some might decrease our ability to sweat normally. And, as we regulate our temperature. We sweat and evaporation cools us down. Sometimes drugs can, make us drowsy, confused, and that might also lead to an issue. Particularly if we're trying to prevent development of heat-related problems. So common medications would be things we would take for high blood pressure, diuretics, and many of the other blood pressure medications. Drugs that we would take for depression or other, psychiatric problems can lead to difficulties. And with allergies, antihistamines, particularly the older ones, can decrease our ability to sweat normally. Another issue about medications and heat is that certain medications like insulin should be stored in the fridge because when they get hot, they degrade and are not as effective. Also, with heat waves, we might have brownouts or problems with power. So you have to think about what would you do if you have a medical device that requires power, like an oxygen enricher or a CPAP machine, and what are our plans to kind of work around that possibility? Even aerosols can explode if you put them in a car and they really heat up. They get just too warm and the gas expands and boom, it can explode. So there are a lot of things about medication. Medications can cause problems, but also how we store medications, how we plan for heat waves also come into this formulation.
So what do you do if you need to be on these medications? Is it just awareness of it, or is there anything else
I,
you can take to counter that? Or
yeah, I think you want to talk it over with your physician. Um, or healthcare practitioner, and because it's not only physicians who prescribe medications, um, and also if you're taking over-the-counter medications, you might want to talk it over as well with your pharmacist, and ask if there's any issues with any of these medications during heat waves. When it's really warm, for example, you might make some adjustments in consultation with your pharmacist or physician or healthcare practitioner about the use of medication. For example, you might decrease the use of blood pressure medications if you're at risk for getting dehydrated during hot weather.
and in terms of hydration,
hmm
is there a set amount that people should be consuming, or does it all depend on how much exertion you're doing?
Yeah, and how hot it is.
Yeah.
It's really hard to give a one size fit all recommendation. But try and in the summertime and when it's warmer, try to drink extra fluid. Um, and I'm talking here about water, juices, not alcohol, because alcohol increases your urine output and might decrease your sensation of increasing temperature within your body. Um, and also, you got to be careful with caffeinated drinks because they increase your urine output as well. So, fluids like water, juices, intentionally drink a bit more than you might feel inclined. But, maybe an extra 1 to 2 to 3 glasses of water a day would not be a bad idea. You're not going to run into problems with that. Now, one thing I didn't mention, but some people have a health problem like heart failure where they are on fluid restriction. So you might want to discuss that with your healthcare practitioner as well. In hot weather, when you're sweating more, maybe the amount that you're allowed or recommended to drink would be adjusted and potentially increased. But again, talk it over.
Can you mention that one a little bit more? And which conditions is your liquid consumption restricted?
It's mainly with heart failure. Um, and because if you get increased fluid retention, it can increase your symptoms of heart failure, like more swelling in your legs and dependent areas of your body, or maybe in your lungs and causing shortness of breath.
That's what's a hard one to balance against extreme
hmm
heat.
Yes. So that's why you should talk it over and get some advice. And in your own home, try to figure out where the cooler areas are.
Mhm.
Spend time there when it's really hot. If you have air conditioning, use that. Um, and if it's really warm, you don't overexert yourself.
Mhm.
And if, for example, you like to go for a walk, you might not go in a hot midday sun, you might think of early morning or in the evening. So I'm not a big fan of evening walks because the bugs seem to come out then. But you might go out at a different time when it's less
Hmm.
hot, or maybe not exert yourself as much.
Right. You touched on a few medical conditions there, but which are there certain chronic conditions that put certain seniors at the highest risk during extreme heat?
I think the ones that would be most important would be conditions which would affect your thinking, like
Mhm.
dementia, psychiatric conditions, as I mentioned before, particularly some of the medications might lead to problems with regulating your temperature. And if you have, kidney or renal problems where you have to be careful about your fluid intake, would be another one I would think about. Cardiovascular or heart conditions would be another one because, for example, if you become dehydrated, you might be more prone to dropping your blood pressure, which could lead to lightheadedness when you stand up, or in fact, you might even lose consciousness and pass out if your blood pressure drops low enough. So those types of conditions you would have to consider. Again, talk it over with your healthcare practitioner and seek advice from them.
Mhm. And in terms of the danger of the heat, I think sometimes we forget about how dangerous it really is. I mean,
Yep.
being a Canada being a cold climate, generally a cold climate country, we have more concerns about hypothermia. But my understanding is that the heat can kill you a lot quicker.
It can, and the other thing that a problem would be in Canada, in particular, a place like Alberta, is heat comes and goes, so we don't get acclimatized to heat.
Mhm.
So that makes it a little bit more difficult. Now, there are some heat-related problems which are fairly mild. I mean, they're still troublesome, but mild, and that would include exercise-associated muscle cramps.
Mhm.
Another one would be being lightheaded or passing out when you stand up because of your blood pressure being too low. You can also get what's called heat edema or swelling, affecting your hands and your feet. They feel, tight in hot weather. And you can also develop a heat rash is something it's called miliaria rubra in medical terms, but it's also called prickly rash. You get these small bumps, usually in parts of the body covered, that can be itchy and have a sort of a stinging sensation to them. And often these things you can get acclimatized to, and if you drink more fluid and hydrate yourself, you can work around these issues. The cramps are often helped by stretching the muscle and trying to keep in cool areas. Now, the more serious conditions or illnesses associated with heat would be heat exhaustion and heat stroke. So, heat exhaustion is that you might be sweating profusely. You get quite fatigued or tired. Um, you have no energy. Um, Heat stroke is it's not like you don't get stroke-like symptoms. It's not like you get paralysis, but you
Mhm.
get confused. Um, and it usually is associated with higher temperatures than you might see with heat exhaustion. And you can go straight into a heat stroke and not go through that heat exhaustion stage. So sometimes it's very hard to differentiate the two. If you have any concerns, I would be calling EMS or emergency medical services and have someone come out and check the individual. One thing that I also want to mention is that measuring temperatures, you got to be a bit careful because with these more serious heat-related illnesses, your temperature in your forehead or in your mouth or in your armpit may not be accurate. And really the only accurate measure of your core or central temperature will be things like a rectal temperature. Um, so, you got to be a bit cautious and careful about that. And also, you can't go by sweating because you could either have a lot of sweating, but also once it gets to a certain point, you may stop sweating because blood is not flowing to the skin anymore and you're not sweating. So be a bit careful about that as well. And generally, with these more serious conditions, what you want to do is cool the individual quickly. So it's more important to cool them quickly because it's not how high the temperature is of the person, but how long they are in a high temperature state. So you want to cool them quickly and obviously hydrate them. And even when cooling quickly, you start doing that even before the person might be transported to a hospital via ambulance. So it's really important to start doing that quickly as you can.
So would that be the first action you should take if you came into, say, a family member's home and they were displaying, so say signs of heat stroke, was to put them in a cool bath
Well,
before
it
anything
depends a bit
else?
on where you are, the stage of the condition the person's in. Um, you also, do a quick check, like how warm is a room, warm is that environment the person is in, because there are other causes, that might cross your mind, particularly if the room doesn't seem that warm. Um, but you also would be hydrating them as well. Um, but if you have a very high temperature, you want to start cooling them quickly. And a cold immersion in the bath would be obviously one way to do it. But I would be calling EMS if I was, thinking about that as well. You can also cool a person by towels,
Mhm.
compresses over their body. Um, but try to cool them, hydrate them, call for help.
Mm. I've often heard this saying that by the time you feel thirsty, you're already dehydrated. Is there any truth to that?
I guess that depends a bit on your age and
Mm,
how well you sense your hydration status. You probably are starting to become dehydrated, kind of moving into
mhm,
that stage, but boundary might be a bit blurry. But
mhm,
particularly when you're older, by the time you are thirsty, you probably are getting low and getting close to dehydration, if not dehydrated itself. Um,
mhm,
so that's why you want to be preventive and drink more, particularly in warm weather.
mhm,
Um, and can't recommend that enough.
mhm. How about things like, Gatorade and stuff like that? Is that a good idea to add anything to your water?
Sure. They're fine. I mean, they're electrolyte balanced, so
Mm,
that's good. Um, as you know, they were developed mainly for athletes or people
mhm,
exerting themselves strenuously in hot environments. Um, I think, Adam's ale water is good enough, for most of us. But if you like Gatorade, there's no reason not to drink that. As I mentioned, I would just be cautious of alcoholic beverages
mhm.
and caffeinated beverages.
Okay, just if it takes putting something in the water to have someone drink it, is is there anything wrong with that? Aside from, I guess, in some cases, the extra sugar or whatever, is there
Oh
anything
no, no,
wrong with
no.
making it taste good to make it
Yeah.
palatable to someone?
Yeah, but you also don't want the fluid too concentrated.
Mhm.
Like it's better if it's more fluid rather than viscous. So like water, which is very dilute,
Right.
obviously, with substances is a good first choice.
Okay, but those water flavors or
No,
things,
I just
something
no
like
no,
that.
no, I wouldn't have a particular issue about that.
Okay.
I
Um,
mean, I would be a bit concerned about milkshakes where the straw can stand up,
mm,
you
mhm,
know, because that's getting fairly thick.
yeah. So is it fair to say people can become dehydrated without even realizing it?
Yes, yes, and if you look at risk factors for having a serious heat related illness, one that comes up frequently is dementia.
Hmm.
So particularly for a person suffering from significant thinking issues and problems of dementia, you want to check on them frequently during the course of a day, and you might well be encourage them, um, to drink more. Um, and these things can even happen in hospital or in long-term care facilities. So, when you visit someone, for example, in a nursing home, when you visit, you might encourage them to have a cup of water with you while you're there. Um, as you, as you know, there are environmental regulations for long-term care facilities, but not all facilities have central air conditioning, and some can get quite hot. The older ones in particular, and and obviously the staff do their best, and they might have portable air conditioning equipment, But the most common thing you see is a fan. And I'm not sure how effective a fan is when it's just moving around hot, humid air. Um, I'm not really convinced that that's a great preventive measure. So when you're visiting, encourage people to drink fluids on a hot day. Whether it's in a facility or whether it's at home, is not an unreasonable thing to do. Um, so I kind of give that advice to your listeners.
Yeah, that's really important in terms of looking out for others. Should seniors have a plan, I guess, in place and in these times of heat?
Yeah, I think it's good to have a heat buddy.
Mhm.
Someone will check on you twice a day. Say how you doing. Um, Make sure that you're up and about and you're drinking. It might be like just a phone check. Probably is better if it's a face to face and check, but that may not be possible for everyone. Um, the other issue, maybe just to raise with your listeners, is that um, heat issues are tend to be more of a problem in urban areas. Because we get what are called heat islands. Because the city itself and the concrete in the city, it absorbs the heat. And you may not get much cooling, particularly at night. So urban heat islands is a big issue. Um, so a city like Calgary, it's more of a concern than as compared to if you're living on acreage outside the city. Um, so keep that in mind. Um, Also, watch out for heat advisories. Um, I mean, if you look at temperature, probably anything above 29, I'd be concerned. You may decide, maybe I want to go for that walk today. And you often hear about humidex, where they look at temperature plus humidity. And, 40 or above would be kind of my limit. I would probably, cut back on my activities and try to drink more when I hear there's a humidex of 40. Something you hear about now, also just relatively new, is what's called wet bulb temperature. You ever hear that one?
Yes, I heard it during the World Cup.
The thermometer has a little bulb at the bottom.
Yes. Uh-huh.
So a wet bulb is you'd wrap it in a wet cloth,
Hmm.
and it looks at how easily you can move heat out. So it looks at the heat, humidity, but also factors in air movement like the wind, and also radiation, sun exposure. Um, and yeah, it's used more for athletes and soccer players. Like, as you know, in the World Cup going on, they get these refreshment breaks halfway through each half, to try to prevent that from occurring. Um, and the other thing that people might wonder about, what was a heat wave? A heat wave would be 2 or more days in a row of extreme temperature. Okay, so when you hear about heat waves, you're looking for 2 or more days in a row. And the other thing you hear a lot about now are heat domes. And heat waves happen often in heat domes where the atmosphere traps this hot air and it can't move. Um, and they had a large one over the July 1st and 4th weekend in the States.
Hmm.
Um, Another issue is where air quality, because when it's hot and there's a lot of pollution, like say from forest fires, it's a doubly bad. So it's something else to keep in mind.
Well, we know that Toronto was the most polluted city on the planet
Yeah.
yesterday. It's Toronto and Detroit today, I hear, as that
Mhm.
smoke goes south.
Yes, and also if you lived in Toronto or spent time in Toronto, it can get pretty hot and humid.
Hmm.
Um, so they're suffering.
Um, are people in other areas better able to um, handle the heat? Like, for example, my husband's working in Scottsdale this summer, and they don't even call a heat warning until it's in the 40s.
Yes.
And so right now, this week, it's in the mid 40s. Um, and once you live in an area like that, as we have many of our folks here are have places in Arizona, do you become, as they say, acclimatized to it?
Yes, you do to a degree.
Mhm.
But when it gets to 40 degrees, it gets to 40 degrees. It's a problem for everyone, but you do get acclimatized. And that can help with the more minor heat related illnesses that I mentioned. Um, but when you talk about, heat exhaustion and heat stroke, um, you don't really get acclimatized to that. It's gotten to, beyond that point. The other thing, of course, is if you're used to heat, you build differently. Your homes are different.
Mm.
Um, as you know, and there was a heat wave and a heat dome in Europe. A big problem in Europe is people aren't air conditioned. Not to the degree you see in North America. So yes, you get acclimatized within your body, but also as a society, you get acclimatized, and that could affect your tolerance for heat waves.
So uh, maybe this be getting outside of your wheelhouse, but is air conditioning the answer? Because I mean that's in some ways, drawing more on greenhouse gas consumption as well.
That's right. It's a two-edged sword, but you're right. More air conditioning, more consumption of fossil fuels, more climate change. So it's a fine line. On the other hand, you do have to protect people from heat illnesses, particularly the more serious ones. And before we started recording, you mentioned going at a rally with Acorn.
Mhm.
ACORN is the Association of Community Organizations for Reform Now. That's the acronym,
Mhm.
ACORN. And they're advocating very strongly for renters that for any rental suite should have at least one room where the temperature is no more than 26 degrees, and that you should have air conditioning. Um, and nearly half of rental suites in Canada are not air conditioned. Um, and there is a move afoot to have municipalities pass bylaws, to enforce this. It is a sense that being protected from serious heat illnesses is a human right, and that we should, take steps to do that. Um, some of the other measures being suggested by Acorn I think is more in the kind of economic social sphere that I want to get into. For example, like tax rebates and issues of that nature. But, definitely I think you want to protect people from being exposed to excessive heat. And I think having a location where you live that's, 26 degrees or cooler and having access to air conditioning seems to me reasonable things.
Mhm. And how about the idea of seniors getting out? Because when I was at the Acorn rally, some seniors were telling me, well, I go down to the Legion just to get out of my
Yep.
house because it's too hot, or I go to the mall. Are these, if you can, are these reasonable solutions?
Well, they're reasonable. I'm not sure it's a full solution to the problem,
Mm.
but it's reasonable. Going to air-conditioned areas like malls is a great example, um, and get out of an excessively hot environment. But my concern with that is, of course, you go back into that
Mhm.
residence that's overly hot, and you're going to sleep there.
Mhm.
And not having that dip in temperature at night is really important. And overnight heat is something we should consider as well.
All excellent points. And I guess we need to be definitely looking at the bigger picture too, in terms of, building codes and in terms of looking
Absolutely.
at climate change as a big picture and how it has its fingers
Yeah.
in really every part of our lives.
Yeah, we live in a complex world,
Mhm.
and you have to be very cautious of people with simple solutions.
Well said. Thank you very much. That's a
Okay.
good note to end it on. Anyone that's giving you a simple solution, be
Okay.
cautious. All right.
Okay.
Thanks very much, Doctor. Appreciate it. Take care.